We create jobs and make entrepreneurial dreams come true. ACE, a nonprofit community lender, specializes in small business loans coupled with business advisory services. ACE has loaned more than $39 million, helped over 725 business owners fulfill their dreams, and ACE has helped its clients create or retain more than 6,200 jobs. These are the stories of those businesses we've helped reach success and claim their American dream.
Welcome to ACE Best Stories. I'm your host, Eric Holtzclaw. ACE's Best Stories focuses on the entrepreneurial journey. What does it take to successfully start, grow, and manage a business? We're talking today with Ricardo Ibarria. He is the CEO of Hygeia Health Inc. So as a Southerner, how did I do with your name?
Not bad.
Oh, okay. A little bit of advice there. I got it. All right. So tell us, Ricardo, what's your business? What do you guys do?
Sure. So Hygeia Health is a company that increases access to healthcare, specifically by making a kiosk or a health station for increasing trust and diagnostics in remote care consults. So when you do a visit with a doctor and they're not with you, they might want to know your blood pressure, as an example, or your weight. So we have a convenient kind of turnkey package for doing that.
Okay. All right. Interesting. So it's a combination of some of the stuff that I've seen where, they're advertising this, and a friend of mine did it recently. She had the flu, right? Mm-hmm. And she was able to go and talk to her doctor remotely, either over Skype or something, and then they diagnosed her that way. But you don't always get everything you need just by having that one-on-one conversation without some of the equipment.
That's correct. I mean, a lot of those kind of scenarios or where the major use cases have been, in hospital. There's a very expensive neurologist, and you don't really want them to go to the bottom floor because this time's really expensive. Or basically, they know what you got, and they just want to talk to you, get your feedback quickly, and get you an antibiotic, as an example.
Okay.
But there's issues with that. I mean, you can do a CBC panel to figure out if what you got is viral or bacterial, and that would help your quality of care in terms of your recovery, what they prescribe. If you've got diabetes, doing those other diagnostics is important. So it's not to say that, that there's been a lot of push in the market space over the last, I'd say 5 to 10 years. But there hasn't been a major adoption of it yet.
Yeah.
As far as the last number I saw was like 0.5% of visits in the United States are, with video or phone.
Yeah, well, and I guess because the correction to what I'm talking about too could be maybe you're not thinking as much about the person in their home as just not having access. Like a friend of mine, I told you before the show, she does women's telemedicine, and it's for rural areas that don't have access to maybe the same level of OBGYN or thing like that. So they use it inside it's still inside a doctor or a hospital environment. It's just to get to a specialist that may need to know something. So where's your application most?
So in terms of where we, when we originally were in an accelerator program, we ranked the kind of markets. It was like employers and schools and pharmacies, but we've, airports are potential. We had kids tell us when we tested with a school that they were interested in putting these at theme parks.
Oh yeah.
I mean, we had some initial conversations with like large sporting groups, although we're still pretty early stage. But there's another market which has been growing a lot faster, which is the home healthcare delivery market, and our product as it stands doesn't really fit that model. But some software and with some tweaking, we could make another solution at some point. We have some interest from a telemedicine group that's interested in kind of that. But we just felt like, in terms of our capabilities and background, that there's a lot more value in that market, and there's some underserved components to it. So
okay, so talk to me about your background. So tell me how the heck did you end up in this business? What did you do before this, and then decide that this was an idea that you wanted to pursue?
I mean, it was some research. I had worked and as an analyst, in terms of my academic background, I studied industrial engineering, but my professional experience is more, pull reports, figure out what's wrong with things, and in a variety of different capacities. But then more recently, I was getting more interested in healthcare, so I had some more healthcare experiences. And, I thought connecting devices was basically the non-interoperability of medical information was a problem. And so I thought, there has to be value in connecting some devices. I reached out to a friend that could help me do that because I'd tried to figure it out on my own and I got lost. And then I started renting a space at an incubator in town called Global Center for Medical Innovation. We were there, basically received some resources there, found out about some of the legal side of things. Once I figured out that we weren't necessarily as regulated, I was like, well, I should definitely try this. And so things evolved. We originally started just trying to save time for medical assistants.
Okay.
The computer is connected to the devices. When they're done, they just click it and it'll be in the record. We found out that, there's more to it, but for the most part, we found out the doctors didn't really care about that. Even though the medical assistants and the nurses liked it, the doctors weren't necessarily trying to speed up the efficiency of their medical assistants. They were thinking about their own billing and their own patients and, a lot of other things. And so we had interest from a telemedicine company. We didn't even think about remote care at the beginning. And they were interested in the device aggregation, so we pivoted to that. I changed our product a bit. It helped us get our first external investment through a company in South Carolina called Iron Yard Ventures.
Okay.
Yeah. That was our first external investment. And so we've kind of just evolved it from there. The most recent thing we've had is an innovation program at Mercer University. Mm-hmm. So they've invested some in us, but they're providing us the ability to do a study with them at their on-site student clinic.
Got it.
And so we're in the process of getting all the paperwork in now. We're hoping to start soon, and I think we will. We're just kind of crossing the T's and dotting the I's. But this will be our first. We've tested it before, but this would be our first kind of academic test. There could be a paper that comes out of it, and so that with that, we will be able to demonstrate the value of it to our potential clients.
So it sounds like, along that journey, and this is often what happens with technology or product-based businesses, you've had multiple times you've sort of had to pivot or think about it differently. What were you doing to learn about that? Was it did you build a prototype and then people gave you feedback, or were you doing some kind of customer research and going out and talking to people about the idea?
I think the most important thing that I didn't do, and I think maybe technical people think about this or don't think about as much as they should, is we thought about the market components of it, but we didn't think as much of talking to as many customers as we should have at the beginning. Even when we did, the more you can, the better. You should. There was a program we did at ATDC called Startup Gauntlet, and we got kicked out of it actually because we had already had a solution or a part of a solution, and they like you do not have a solution. They like you to be creative and talk to your customers and figure out what they really want. So, we would have crashed and burned. We could have maybe sold just the kiosk by itself in another market, but we're in America, right? We need to figure it out how to sell it in America first.
Right.
So, I think that's a major bit of advice is, you need a marketing or a salesperson or a business person that can think about that at the beginning. There are businesses that start where, the guy makes up something, right? And then he got a customer, he says, I've got this, and he doesn't really have it, and they go find somebody to build it. Those are the best ones.
Right. Right.
Rather than, hammering away at something for a while and not knowing if you're making progress.
Yeah.
So there's that, and then there's also, I think that's the most important thing, And maybe another piece of advice would be, in terms of pivoting, you really have to be listen to as many people as you can, and really listen, not with the intent to get anything out of it. I mean, you might find people that weren't your originally going to be your target market will end up being your customers, because they say, oh, I've got this, and you can solve that problem better you can the people you're talking to.
Yeah.
I think that's actually one of the most important skills that you want. I mean, I definitely had to work on it. That's one of the most important skills in terms of being able to solve a market need.
Yeah.
Is listening, right?
Right.
I mean, it goes to your employees, it goes to your customers, it goes to investors as well. I mean, it's all sorts of things.
So is it just based on, because there's some of us in this world who we want to fix the problem, right? Like, we're ready to get started. Is that where that came from, or did you feel like you'd already done, because you had that analyst background, so you may have already I identified the gap, and so I know what I need to go build.
Need that component of it too, and I think I brought that, where I just read everything and I kept spewing out numbers and people didn't know what I was talking about.
Right.
So you need that business side to kind of condense it, kind of control the burn, if you will. But it's really important to understand what the market forces are, what the current capabilities of people in the market are, where technology is going. So, I mean, predicting the future, especially in technology, is hard, even if you know what you're doing.
Right.
So if you don't know what you're doing, maybe you should sell sandwiches. I don't know.
Right.
It's a pretty solid business.
Well, you've got like the predicting technology, but you're also in the medical space, which has had a tremendous number of changes, not just even from advancements, but even kind of around it as it relates to insurance and how it's being supported. So you have a lot of things kind of happening around what you're doing.
With healthcare specifically, and I think you can see this even with like big technology companies that are thinking about getting into the space now, there's more regulation. Things need to be more ironed out before people adopt it. You don't want to have somebody get hurt when they use something or even die. I mean,
right.
You don't have that necessarily in some other industries with new products. And so it takes more time, and there's a lot more things you have to do. And in some ways, I think that the bar is higher for products. So, something that might have been used in a factory setting that for sanitation, that you need to modify it a lot, improve it a lot for use in a hospital.
Yeah, that makes sense. Makes sense. So what we're going to do is we're going to go to commercial break, and when we get back, I want to talk a little bit about how you, because you've been through the process of raising money, right? So and that's not something that every person has done. It sounds like you've got a set of investors that you're working with. So how do you do that?
Sure.
What worked for you? What are you learning along the way of working with those investors? How do you keep them informed? Because if I'm going to build something that requires investors on the back end, it's a very different kind of business and thought process to it. So
sure.
Back in just a second, we're talking to Ricardo Ibarria. He is the CEO of Hygeia Health. You're listening to Ace's Best Stories. I'm your host, Eric Holtzclaw. We'll be back in just a minute.
If it wasn't for ACE, my business may have closed in 1 year.
If it wasn't for ACE, my business wouldn't be expanded as much as it's expanding right now. They were there for me at the time of my need.
If it wasn't for ACE, we would not be here today.
Yeah.
If it wasn't for ACE, I would very much still be cooking at an hourly rate, and I would have never impacted hundreds of lives and an entire community.
I still remember going to different kind of banks, big banks, and with papers, and these people send me back because I don't have, I had experience in the restaurant business, but I don't have, everything else this bank needed, and I believe in me.
I did the research in Adult Day I had experienced it personally because my grandfather had Alzheimer's. So I wanted to do the business myself, get into it because I knew I could make a difference.
Initially, when we started, there was only one person, which would be me. And then the company I've grown from 1% to 8, and we provide quality assurance, quality control testing for FDA-regulated companies.
I think Grace not only completely understands what it's like to start off in an office connected to your laundry room or wherever she was, but she also understands the growth process, and I think that she does an excellent job of making sure that everybody who works with ACE has an understanding of the kind of struggles and celebrations that you can have.
ACE has helped us with putting our business idea into the market, working with us with the business actually working, actually showing us, guiding me personally how to solve some of my marketing issue problems or with the business planning.
You don't meet many lenders that are invested in your success. And, you know, from their classes or presentations, seminars, they really do have a vested interest in your success.
The best advice I can do to small business owners is follow your dreams. You know, always follow your dreams, follow your heart.
Have a plan. Just because you have a passion for it doesn't mean that you can start a good business.
Get ready for the ride of your life, and definitely make sure that you look out for fantastic resources like ACE.
ACE is the way to go.
You're just the best. I really are.
And we're back. You're listening to Ace's Best Stories. I'm your host, Eric Holtzclaw. Ace's Best Stories brings you the entrepreneurial journey story. This is kind of an interesting one we have today. We're talking with Ricardo Ibarria. He is the CEO of Hygeia Health, and I'm using my Southern to make sure I say his last name correctly. I got Holtzclaw, so, you know, but it's just like clearing your throat. So Hygeia Health, it's an interesting model, and you've been through some of the things that a lot of companies who are thinking about building a product or service, you know, you hear about pitching and investors and incubators. So talk to me about, did you decide to go to an incubator first? Was that later down the path? When did you know to bring an investor in? Tell me about the story of making the decisions of kind of getting started.
Yeah. I mean, I'll talk about, you know, the way it happened for us. I mean, I think one of the things that I would say is most important to small business owners is that you shouldn't raise money. If you don't have to raise money, then don't.
Right.
That's not usually the case for technology organizations. There's a high R&D component to it. But I mean, it does two things. One, if you're spending your own capital of friends and family, it helps other people, and it helped with us, say, well, these guys are committed to it. I mean, if you're putting up your own savings or your own net worth into it, you know, that's reassuring. There's a caveat to that, which is the complete opposite, which is, you know, once you get into the point where you're in a business, you want to raise as much money as you possibly can. I mean, almost by definition, when you're out of money, the business is dead, right?
Right. Yeah, cash is king.
Yeah. So I mean, it's a little give and take. I mean, if you're already, a good kind of business is, or the best one is where you're already making money at the beginning, or you got a contract before you started developing it. In terms of how it happened for us, I mean, short story with investment is friends and family at the beginning, external investor. First one was an incubator, the Iron Year Adventures. I thought that was a great program.
And so you went through the program and because you had gone through it, they felt like you were a worthy investment. Is that how it worked? Or
Yeah, I
was
mean,
it
they
the
had
investment, then you went to the incubator.
No, they have a due diligence process, and then they help with reforming the company. There was more benefits to it besides just the money. So wonderful experience. Helped us, add the telemedicine. Helped us decide that the original telemedicine company we were going to work with, we didn't sign the agreement that we had with them. And so, fast forward a little bit, having that investment so far in helped us close a small business loan. They like to see with ACE, which was great. It's a long process, but I mean, it's important to get the things done correctly. And they really like to see, that you've had the business, for 2 years, especially with the SBA as an organization, and a lot of founder or friends and family invested into the business.
Okay, so 2 years, at least you've been around for 2 years, and they want to see some skin in the game from some of those people before SBA really.
Yeah, and then maybe to echo Mark Cuban, you shouldn't start the business with a loan.
Yeah,
you should never do that. I mean, with our situation, I think it made the most sense, because we had a very specific milestone we wanted to get to, and we we're going to use all of the cash right away. But never do that. I mean,
yeah. So you say friends and family, and that sounds simple, but it really isn't, right? I mean, you've got to sit with somebody and convince them to take their money and put it into your idea, right?
Yeah. So when it's friends and family, you it really helps if it's you first, or you or your partner first.
You and then friends and family.
Yeah.
Right? Yeah.
I mean, you don't. I mean, maybe you can just go out. If your friends and family are pretty successful. For me, it was basically a good bit of my savings, and I was very methodical with, okay, we're going to do this. We'll have a budget. And a lot of the research wasn't too expensive for what we were doing at the beginning, so it wasn't that big of a deal.
Yeah.
Once we got to the manufacturing side of making the kiosk, that's when the cost started going up a bit, and so we've made. This is probably, I don't know what you want to start calling the first prototype, but 5 to 7 versions of it.
Oh wow!
Like a physical product. The one before this and this one look like ones people would use. So I mean, it takes a long time to get there.
Yeah.
And when you're in product development, maybe 5 iterations is probably standard.
Yeah.
So we just went over that because we were new.
Yeah. So just people see it because I've seen investment in different ways, right? So there's sort of people who know how to invest in different types of things. Mm-hmm. And yours feels like you could have investors who are very familiar maybe on the medical side, but then it also could be groups that are maybe more technology oriented. Have you seen it be one or the other? Is it like a technology first thing or a medicine thing first?
The thing is, it's both. So it's hard to. I mean, it's
to say.
We're structuring the business as a service, and so you need to have the clinical component and you need to have the technology component. I mean, in terms of the 2 external investors, one is basically a business school and working with medical schools, so the clinical side, the non-technical side, and the other one was the foundation of a coding school, so the technical side. And then even going forward, I think it can be a combination. Ideally, someone that has experience with both. But sometimes for the right opportunity, organizations can say, "Oh, there's a really big clinical need for this." If they, we'll do a lot of due diligence on the technology to make sure it'll work. But we're really interested in it for the clinical application, and maybe vice versa. There's something that starts off clinical, but the technology group wants to transition it into putting the technology in cars or something. I don't know.
Yeah. Okay. Yeah. So some other kind of application for it. As you start to consider, you talk about prototyping it, then moving into manufacturing. So how did you go about the process of prototyping it? How did you get that done?
We had a mechanical engineer contracted with a designer. the mechanical engineer kept rebuilding the model, and then we would make, once we rebuilt the model, we were satisfied with it, we would decide to make it.
When you decide to make it, like, are you like 3D printing it? Did you have to send it off to a shop?
So our unit's mostly aluminum.
Okay.
So it would be a metal shop. There's some steel and some 3D printed parts, and computer or monitor, some stuff you would just buy.
Yeah.
So the biggest challenge is that's short runs of this kind of equipment is not typically something that a metal shop will do.
Right.
So we've worked with a couple smaller ones, family owned, to get just the shell, and then we've kind of assembled it. So it's a lot of work, but we really felt like the design, and we put a lot of work into it, of the unit would be a major competitive advantage, at least for some time.
Yeah, right.
And so we're about to find out if that'll pay off soon.
Yeah.
I mean, usability is very important for technology.
Right. Yeah, certainly. And the thing with, I hear that story often in creation of physical product. It's getting the original prototype done, but then also you got to go find someone who's going to be willing to manufacture it. And they love you when you're making a lot of them, but when you're in the beginning, it's like, who are you and why should I care? And
they're hoping that you'll get successful, and then you which makes sense. But I mean, even if you're manufacturing a physical product, even if it's digital, usability is a lot. So
yeah. And so as you're thinking about the future, so where you guys are headed next, like what's on the horizon for the business? How are you measuring the next? You said you were very milestone driven. So what are some of the milestones you're looking for to know that you're on the right path?
I mean, the main market issue that we want to address with our study is showing that we can increase utilization in a patient population. So whether that's a school or an employer, I think that will translate into us selling our first units. We've got a small inventory now, potentially raising some more money and starting to scale the business. In terms of where I see the future heading, I think a lot of people now agree that, because that wasn't always the case, that remote care stuff is the future of healthcare delivery. By that I mean where there's a lot of use cases where the clinician doesn't have to be with you.
Right.
Then you can augment, things digitally to make the experience better, make it easier for patients. And so now it's the harder part, which is once you have the buy-in, it's implementation.
Right.
And so
there's so many pieces to it. It's like building it, getting someone to buy it, then you got to support and implement it. Yeah.
And that's actually, I mean, the bigger, longer term, I mean, remote care stuff, I think will be around for a long time.
Right.
It'll just get better. Same thing with like cell phones. They've been around for a while, but they've certainly gotten a lot better.
Right.
And so, we see ourselves potentially pivoting to other markets, or adding new products to address different markets. But we're really going to focus on, especially when you're a small business, you waste too much. You have limited resources, and you don't want to spread them thin. You want to find out what's your go-to, what's your beachhead, what's your target market, and just hammer that.
Yeah. So when you talk about utilization and increased utilization, do you mean more people using it, or people using it more often?
Both.
Both.
I mean, if maybe you have a chronic condition patient, and instead of coming in once a month, they come in twice a month or something to do. To talk with an endocrinologist or something. But, if you're looking at like an employer population or a school, let's say the amount of people that will be willing to see it pop up their phone or and use a medical service remotely is about 3 to 5%.
Oh, wow. Okay.
So, and those aren't necessarily taking the place of in-person visits. Those are, I've got the sniffles. Let's check it out. Or,
It reminds me of like paying bills back in the 90s, right? Like there were just a few of, I did it very early, right? I was one of the few first people, and the company I worked with cut the check and sent it. And now you would never think, you're like, yeah, of course I'm going to go online and pay a bill. So it's sort of at the beginning of that. Yeah.
I mean, and there's a consumer awareness side of it as well. But, you know, the trust, a lot of consumers, when they go into these things, they still don't trust them. I mean, a lot don't.
Yeah.
And if we can provide more information to the remote physician or nurse practitioner, whoever it is, and make the patient feel more comfortable, so it's a kind of a cool experience, like, wow, that was kind of cool and it was fast, then we want to see that number increase. I mean, there's more to it than that. There's the tests you want to do, how easy it is for the patient. But, you know, we want to show that we can meaningfully increase that number.
Yeah.
And so that translates into saved money for whoever the organization is, the school or the business. We don't know what that return on investment is going to be. We have an idea, but soon we will. And I think that will, you know, in healthcare, it's important to have what they call the triple aim or the quadruple aim, which is you save money, you increase quality, and I think there's another one, I should know it. You know, it's hard to do both at the same time, or all of them at the same time.
It sounds like that better, cheaper, faster. Like you can't,
exactly.
You can't do all of those at once.
Exactly. So usually they'll do one or the other, but I think it's part of the reason there's been over the last few years a dip in medical device investment. Just rotely, it's more digital now, just purely digital. And so I mean, I don't see that changing necessarily. It's more about everybody's constrained.
Yeah.
In the system, and if you got to get a win-win-win for it to sell it.
Very cool. Well, thanks so much for joining us. It's been it's an interesting story. I love to hear the kind of new product. That journey is a lot different than some of the others that are out there when you're trying to bring something brand new to market. So we've been talking with Ricardo Ibarria. He is the CEO of Hygeia Health. You've been listening to Ace's Best Stories. I'm your host, Eric Holtzclaw. Join us every Tuesday night at 9 p.m. as we bring you another story along the journey of how to build a business.